Hi everybody, I'm Dr. Jon LaPook. Welcome to CBSDoc.com. Let's get right to it. We're going to talk today about healthcare reform, and that topic has heated up in the last week. One of the major issues is the question of a public option. Should the government offer an option for an insurance plan to cover people in addition to a private insurance option? Now, I have with me two people who represent two opposite ends or divergent ends of that spectrum. Mr. Wendell Potter, who was the former head of PR for Cigna. Welcome. Thank you very much.
Thank you for asking me.
And also Robert Schlossberg, who is the executive director for Benefit Mall. Tell me who you are and where you come from.
Right. Well, right now I'm a senior fellow on healthcare for the Center for Media and Democracy. And as you mentioned, I was formerly with Cigna. I've been in the insurance industry for 20 years, and 15 of those years at Cigna as head of corporate communications.
And Rob, tell me where you're from.
Surely. First of all, thank you for having us.
Pleasure.
I am from Benefit Mall. We're a national general agent, and basically we're the infrastructure for brokers, carriers, and ultimately the end user, the consumer.
Last week I had the honor of going to the White House and interviewing President Obama, and I asked him the following question. What do you say to the private insurance companies who say, we can't go up against the federal government, that's just unfair, they'll clobber us, we're out of business?
Well, the private insurance companies have said that if, as part of an overall exchange, we provide a public plan, an option for people where they can go and get health insurance through this public plan, not having to worry that that public plan is charging profit or looking for profits or doing other things that affect their bottom line but may not be good for patients. The insurance companies feel that, well, maybe that's going to be unfair competition. What we've said is, as long as we're not subsidizing that public plan, as long as taxpayers are not paying money out of pocket for it, but the public plan has to survive on premiums just like everybody else, if they're more efficient, if they're providing a better deal, that is going to provide the kind of competition that will whip the private insurance companies into shape. And private insurance companies always say they're giving the best possible deal to their customers. They should be able to handle a little competition from a government that they say is wildly inefficient and can never get anything done.
Mr. Schlossberg, I'll turn to you first. What would be your response to the president?
Very nice soundbite, but let's look at the facts. The facts are, as it was presented, as you presented it, that a public plan would put the private carriers in at a disadvantage. And the disadvantage would be, number one, that private carriers have to pay premium tax. They have to pay $15 billion worth of premium tax per year. So that's revenue that would be lost actually by each state. Number two, under a private plan, there are mandates that are implemented by the state that wouldn't be required under a public plan. Number three is under the public plan, the amount of distribution to the physician and the hospitals is based on Medicare approved rates, whereas in the private carriers it is based on higher rates and or medically necessary rates, etc. So the bottom line is when you put this all together, it's very, very difficult for a private carrier dollar-wise to compete effectively with a plan that's going to be much, much cheaper than a private plan
Mr. Potter, what would you say to that?
Well, I think the president's right. The public plan could be structured so that it doesn't have an advantage over the private plan. One of the reasons why I think it could operate very efficiently is that a public plan would not have to make the profits that most of the private plans do. Over the last 15 years, the health insurance industry has changed considerably from one that was dominated largely by nonprofit companies to one that's now dominated by for-profit companies. And a large percentage of premiums that are paid by you and me to our private insurers are now going for things other than for paying premiums. In 1993, only as much as 95% of our premium dollars were being used to pay medical claims. Now it's just slightly above 80%. So what we have seen is that there has been more and more money that's being taken from policyholders and diverted to things like sales and marketing and underwriting and to pay executive salaries, but primarily to help enhance shareholder value, to send money into the shareholders, the people who own those companies. So I think that the public plan could operate very efficiently. The private insurers could operate, I think, effectively, but they might not have as much of a profit margin as they currently have.
Do you think philosophically that private insurance companies just cannot compete with the government if they, you know?
Again, going back to the same line of thinking, they can absolutely compete with the government on a level playing field. So in other words, if everything is the same and all the rules are the same, absolutely they can compete effectively. And I think personally, you know, just to get down to the gut level of what we're talking about, is that if there's a little bit more oversight in the industry, there are things that can be done to the existing system that can take us well beyond what we've been discussing here.
What's wrong with the existing system?
Again, according to, it depends on, you know, which philosophy, you know, that you're looking at. I hear it all the time. We have a unique perspective. We represent the carriers, we represent brokers, and we represent clients. So trust me, I hear it from all ends. It's not just everything is fine and everything is good. Things need to be changed.
Like
there
what?
does need to be. What needs to be changed is there needs to be some oversight. There is definitely testing that goes on that doesn't have to be. There has to be some tort reform so physicians can feel like, you know, they can practice effectively without the threat of being sued. And you know, when you look at all sides of the scenario, there is a compromise to be had. But the compromise, in my opinion, is in the private sector, not in the public sector.
It seems like you've heard, it's sort of been the calm before the storm. You've seen a lot of conciliation. The president's brought various people into the White House. All the groups seem to be agreeing that something needs to be done. And now, just recently, you're seeing some things heating up. You're seeing commercials on either end of the spectrum. On the one hand, some commercials are saying, we need health care reform right now, like this.
When I lost my job, I lost my health insurance too.
It's time.
It's time for health care reform.
And then other commercials are saying, hey, not so fast, like this.
A risky experiment with our health care.
What's happening in this battle right now? I mean, it sounds like it's getting a little contentious. What's going on?
It's happening like it played out last time. You had initially the insurance industry coming to the table and saying, we are for health care reform. We support, in fact, if you look back at the transcripts of testimony in 1993-94, you'll hear them saying the same things then as you're hearing them say now. One of the things that always happens is that before there is actually legislation to vote on, the special interests will say we're for reform as well. When you start seeing language that appears in public from the committees, then that's when behind the scenes especially you'll see the special interest, including the insurers, start to gut reform. That's what you're seeing right now. The commercials are often being funded by front groups or organizations that are funded by the industries. So that's part of what's happening, part of what happened 15 years ago.
So, Rob, I want you to give your best shot at saying your position about public versus private insurance.
My position is simple. There is no place for a public option in the current plan.
And just quickly, what is the insurance industry most afraid will happen if there's a public option?
It's very simple. What it is a shift of cost. And what happens is if the public option is priced at a lower level, there was a study done said that eventually 2/3 of the population, the employer population, would go over to the public plan. At that point, and I don't think anybody would have any disagreement with this, the insurance companies could not survive.
If you were able to talk to President Obama for, say, 30 seconds, what would you say?
You need to vet the process. There are a lot of problems with, you know, whether we're talking about the public option or the private option. This does not have to be voted on within 2 weeks. It needs to be vetted. There's a lot of discussion that needs to go on to come up with the right solution.
And Wendell, what would you say?
I'd say, Mr. President, the public's behind you. Stick with your deadline. It's important. The longer this drags out, the more the special interests will have a chance to try to destroy health care reform as they've done in the past. They've had 15 years to get this right, and they haven't done it. So, Mr. President, stick to your guns.
All right, well, thanks to Mr. Wendell Potter and Mr. Rob Schlossberg, and maybe the president is watching. I hope he is. Until then, thank you so much for joining us. I'm Dr. Jon LaPook for another episode of CBSDoc.com. Good day and good health.